Welcome, everyone. I'm Dr. Noel Espallardo. I'm currently the chair of the research committee and also the chair of the publication committee and editor-in-chief of the Filipino Family Physician Journal. I will be presenting in this session, I'll be presenting or giving you advice on how to write your biomedical research paper. Before I go on, I would like to share with you some of the standards that are currently accepted in writing research papers. So if your research paper is a clinical trial, the standard is CONSORT. You can download these standards in the internet and it's available for free. And on page 2 of these standards, you will see the outline on how to write a clinical trial. There's also standard on epidemiologic studies, case report, cross-sectional studies, or case control studies and cohort. And it's called strobe statement. Again, in the second page of this, you see the outline on how to write this type of study designs. For meta-analysis, we have the Prisma as the standard. So again, you can download all of these standards for free in the internet, and you can use the outline presented in these standards when you write your final research paper. Anyway, let me proceed. These are some of the myths that you need to avoid in writing a research paper. One of the myths is that the more pages, the better. No, again, I would advise the residents. It is not true. And most or some residents, when they write paper, they use complex sentence. No? Again, as much as possible, better that your research paper is submitted at 30-page double space, no more than 30 pages. That is already double spaced. Use active sentences, no? Simple active sentences, and present only useful information. It's not necessary that you present all the data that you have collected in your research. No? Only the useful information that you think will be understood by your reader. And our Filipino family physician recommend this structure. No? So you have your first page, the title and author's name. The second page is the structured abstract. So one page for the abstract. And then introduction. Okay, so the introduction should only be about 4 to 5 paragraphs. And then one paragraph for the general and specific objective. 4 to 6 paragraphs for the method. And 4 to 5 paragraphs for the results. And within that 4 to 5 paragraphs of the result, about 1 to 2 figure and 2 to 3 tables. All right, no more than 5 figure and tables combined. And then in the discussion, also, number of paragraphs will be 4 to 6. And for the conclusion and recommendation, 2 paragraphs, 1 paragraph each. Okay, so if these are the parts of the research paper that we are recommending, how do you write it? Okay, so this is the sequence as you can see it in the pages in the recommendation of the journal, but when I write a research paper, it's not the sequence that I follow. This is not the sequence that I follow. What I follow is the sequence on the right side. So I start with the results section. Now, why do I start with the results section? Because after doing my protocol, after collecting the data and analyzing the data, what I have in the data analysis are information that should contain the results section. So while the data analysis concept are still free, are still fresh in my mind, then I write the results section. After writing the results section, I go to the introduction. So I introduce my result, and then I discuss my result, and then I come up with a conclusion out of my discussion. So all of these things, introduction, discussion, conclusion, revolves around the results. And then I would do the method. No? Last is the method. Because the method is just copy-paste from your protocol, and you transform it into a past tense. Okay? Then references. After the references, I write the abstract, then the title. No? So I don't start with the title first. I start with the results, introduction, followed by discussion, conclusion, methods, references, and then abstract, and then the title. So that is my sequence. Okay, so how do I write the results section? As I've said, the results section is basically the major scientific contribution of the research project. And when you write the results section, please distinguish data from relevant information. Everything that you have collected in your data collection form are data, but some of them will only be relevant information. So you don't have to present all of them. All right, some of you might be having something like 3 or 4 pages of data collection form, especially the questionnaire, no? So you don't have to present all the responses to the questionnaire. If your questionnaire has a scoring system, then just present the score. No need to present the responses to the individual question of a questionnaire. All right? So anything that you measure is a data, but not all of them will be useful information. Only present the useful information. Again, in the results section, please avoid the tyranny of the P. All right? That's what I call the tyranny of the P. Some residents or some researchers would prefer only reporting those findings that are statistically significant. No. Statistical significance doesn't mean that it is clinically significant or doesn't mean that it is important to the reader. For example, why would a 1% increase or better improvement in health, a 1% improvement in health be more significant just because the p-value is 0.03? While another intervention shows that there is a 30% reduction in mortality, and you're going to reject this 30% just because the p-value is 0.06. Again, you need to balance. Avoid the tyranny of the P. Okay? So focus your presentation. Make sure that you're focusing on the effect size. Is it 1%? Is it 30%? And then later, just tell the reader that, the p-value is not enough. So which means that you don't just have enough number to say whether this finding is statistically significant. So this is how you write in the results section. When I write, I start with the tables and the figures. So this is how I write my table. This is an example. You have a title, diastolic blood pressure of elderly hypertensive before and after treatment. So that's the title on top. And then you have the row heading, male, female, and then the column heading, before and after. So, and then the data, which is the systolic blood pressure, and the p-value, with some asterisks there. Then the footnote on what was the statistical analysis used in order to arrive at the p-value. Okay, so this should be the basic structure of a table in your results section. When it comes to figures, it also should have these labels. The difference between a figure and a table is that in a figure, the label is below the figure. Okay, and then make sure that each bar should also have a label. All right. Now, another suggestion or another important advice to the writers is that when you choose colors in your bar graph or in your figure, you make sure that they can be distinguished when printed in black and white. All right. When you submit your paper, it's usually black and white. Our journal is in black and white. It's expensive to have a colored journal. So our journal is black and white. And if you have same shades of colors and you print them in black and white, then you will not be able to distinguish them. So make sure that you have significant contrast in your color choices. All right, so this is the number of tables and figures that we recommend. Only 2 to 3 tables and 1 to 2 figures. All right, and observe labeling and then focus on conveying the effect sizes rather than the p-value. Okay, the results section text also has a structure. Paragraph 1 usually is a description of the population, the source of information, the respondents, description on how you obtained your subjects. And then paragraph 2 is usually the description of the demographic and clinical profile of your subjects. Paragraph 3 will be the description of the primary and secondary result of the study. And if you have subgroup analysis, that is usually in paragraph 4. If you're doing a clinical trial, usually the last paragraph in the results section are the side effects or adverse events. Okay, so this is a bit standard. Even if you read journals, published journals, this paragraph sequence is a bit standard. Okay, so let's look at the paragraph 1 and how do you write the first paragraph. Paragraph 1 is usually a description of the diagram, no, like this. How many are patients recruited, or how many were screened, how many fulfilled the inclusion criteria and eventually signed informed consent, how many were randomized into 2 groups, and then how many were dropouts, and then how many completed the study. So that's the outline, no, when you write your first paragraph. Now, when I write a paper, I start with a bulleted outline. Once I have this bulleted outline, I convert them into sentences. No? So how many were screened, how many were included and excluded, reason for exclusion. So I convert them into sentences like this. So here, a sample. A total of 70 patients consulting an acute respiratory infection was screened in a clinic in Cavite. 66 patients fulfilled the criteria, but 2 patients were excluded because of and so and so. So these are bulleted sentences. So it's easy to start with bullet sentence because you can insert or you can add 1 bullet in the intervening sentence if you think you need to put more information. Once you think that the bullet sentence or the bullet outline, the detailed bullet outline is already complete, then you can just remove the bullet and convert them into a paragraph, something like this. So here's now your first paragraph of the results section. All right, so it's really easy writing a biomedical paper if you have a system or a process and you're following a certain structure. And I have recommended the structure for the results section. Okay, so final advice on the results section. Go back to your objectives. Before leaving the results section, go back to your objectives. Are the tables and figures answering your objectives? The narrative of your results, do they introduce the tables? Are they complementary to the tables in the figures? So if all of the answers to this are yes, then after the results section, I am now going to write the introduction. Okay. Now, even the introduction has a structure, but I would like to remind the researchers that the introduction is important because it's the one that will attract the reader, that your topic is important. You need to tell the reader why your study is important. So that is in the introduction section. And in the introduction section, it also has a structure. The first paragraph is the overall introduction of the topic or the research. The second paragraph is the previous studies on this particular topic or subject. The third paragraph is the problems with the previous researches. And the fourth paragraph will be, what did you do to address these problems? And then lastly, the objectives and the specific and general objectives. Okay. In some areas or in some settings, the objective is usually the last sentence of the paragraph of the fourth paragraph in published studies. But in our case, because we treat research as a contest, most of us would prefer to have a separate section for the general and specific objectives outside of the introduction. But in published journals, the objective is usually part of the introduction. Okay, so how do I start with paragraph 1? So again, start with 3 to 5 sentences. So here is an example of the ARI, acute respiratory infection in family practice, the causes, the burden. So again, this is the outline of my first paragraph. What do? I convert this initial outline into a detailed sentence. So acute respiratory infection affect millions, and is a common reason for consultation in family practice clinic. They usually present with cough, sore throat, colds, and fever. 90% caused by viral infection. And so on. So again, the bullet sentence. If I'm already comfortable with the bulleted sentence, then I convert that to paragraph. If not, then I insert more bullets sentence to add more information, and then I try to read through them if they make sense already. Avoid giving too much information in a single paragraph. Okay, so when the bullet detailed sentence is already okay with you, then convert that into a paragraph. This is now the first paragraph of your introduction section. Acute respiratory infection affect millions of patients, both young adult, and this is a very common reason for consult in family physician clinic, and so on and so forth. All right, so again, as you can see, it's easy to write a biomedical research paper as long as you're following the structure. So the structure in the introduction section, the second paragraph would be the previous researches. So you can start with Medline search and then summarize the findings. Summarize the findings of previous researchers. You don't have to discuss each studies. No? So if you found out 6 relevant studies to your paper, you don't have to discuss the result of each of the individual 6 studies and come up with that 6 paragraphs out of it. No, you summarize the finding. And then you summarize what were the problems in these previous studies. That's your paragraph 3. Okay, so that is your critique of the previous study, so that in paragraph 4, this is now your justification on why you're doing the study. All right, and then it's followed by the objectives, which is usually the last paragraph of the introduction, or you can have it as a separate with a general objective and a specific objectives. Okay, so that is your introduction section. Before leaving the introduction section, there is a checklist again. Are all the major elements described based on the paragraph structure recommended? Can someone not familiar with the topic, when they read it, do they find it interesting? All right, were you objective in criticizing the work of other authors in the past? If the answers to all of these are yes, then you can now go to your next section. And in my experience, I would usually go to the discussion. I started with the result, I introduce my result, then I will be discussing my result. In the discussion, it also has a structure, no? So, but before we go to the structure of discussion, let us look at some tips first. The discussion must be presented, you don't discuss the twigs or you don't discuss the details. No? Don't lose sight of the overall results or the forest for the details in your findings. No? So do not be too detailed in your discussion. You discuss only the relevant, significant findings. Not all data need to be discussed. All right. So basically, this is the structure of your discussion section. Paragraph number 1 is a summary of the significant findings. Paragraph number 2, what do you think your result means? What do you think your finding means? In other words, what is the significance of those findings to the health system, to the practitioner, to family physicians all over the country? So what do you think will benefit? No? What benefit will they get from this particular study? And then how did your results compare with other authors? No? So here you're just going to strengthen your findings, whether it's similar or different from the other authors. And then, of course, the next paragraph would be the limitation of your study. Okay, no study is perfect. Most studies have some limitations. Okay, so paragraph 1, discussion. No? So summarize your findings. You don't have to repeat your results here in paragraph 1. You summarize only those things that are important or that you think would find the reader or you would make the reader interesting. So what are the useful things that interest the reader? Number 1, if the main results that you summarize in the discussion are different from the findings of other authors, that makes some interesting reading. Or those that confirm or deny your hypothesis. And even negative results are also important findings. If you found out that there is no significant difference between drug A and drug B, then it is also important, especially if drug A is more expensive than drug B. No? It will inform our family physicians that despite the difference in cost, the effectiveness is the same, then I would prescribe to my patient the drug that is more affordable, no, rather than the more expensive one. So a negative result is still an important finding. Okay, and then the paragraph 2, you should have something like this. No? When you present or summarize your result, you should be proud of the result and make sure that it has some implication in the health system. For example, this is the second paragraph of a study on determining the relevance of a home care program for stroke patients. No? Sometimes stroke patients occupy the hospital for a long period of time, but you can actually do home rehab. No? So this is one second paragraph finding of one particular research that I got involved with. Our findings have important implication for healthcare providers and policymakers. If home care program is formalized as a regular service, The hospital's overloaded bed capacity will be decongested. At the training level, the residents will have more competence to manage stroke or cancer patients with minimal cost for the health system. For patients and family, the home care program will provide opportunity for them to strengthen their relationship and growth. So if you read this kind of paragraph in your research, then you're promoting the relevance of a home care program, and eventually, maybe even PhilHealth will pay for a home care program for patients who have stroke or cancer, right? All right, so you should have that in your paragraph. And then, of course, the conclusion and recommendation. 1 to 2 paragraph for the conclusion and recommendation. So that is your discussion. The next, before you leave your discussion, conclusion, recommendation, make sure that you have discussed your findings. You have indicated the strength of your findings through your own conviction. And your conclusion and recommendation should have answered your objectives. All right? So once you're finished with the conclusion, I will now write the method. And I guess writing the method section is easy because the method section is actually your protocol. If you have developed your protocol very well, approved by your IRB in the hospital or in your program, then you're just going to convert the methods in the protocol into a past tense. No? And again, the method section also has a structure. The first paragraph should be the design. The second paragraph should be the subjects and the setting. The third paragraph, if you're doing a clinical trial, is an intervention. If not a clinical trial, you're doing a survey or case control study, then it's an exposure. Or if you're just doing a survey, then you measurement. No? How did you measure or how did you construct the questionnaire? No? And then how did you administer the questionnaire? And then the last paragraph would be about data analysis. Okay, so you have 5 paragraphs for the method section. And you have to write this in the detailed enough so that the reader can duplicate your work, no? In their setting. Okay, so the design is usually the first paragraph of the methodology. The first sentence should be the general statement of a design. This was a randomized controlled trial. This was a cross-sectional study. And then after that single statement, you follow it up with subject recruitment, intervention, then measurement of the results. Okay, so here's a sample outline of a randomized controlled trial. First sentence is the general statement of the design. This is a double-blind randomized controlled trial comparing experimental versus placebo. Patients with symptoms and diagnosed to have acute respiratory infection were recruited for the study after signing an informed consent and so on. Then they were randomized into 2 groups, and then afterwards they were monitored in terms of severity of symptoms. They were followed up after 1 week, and the difference in their disease status after follow-up was compared between the 2 groups. Okay, so you have here 6 sentences or 6 bulleted detailed sentences for first paragraph. And then if you're now comfortable in your design description, you can just remove the bullet and convert it into a paragraph like this. Okay, so again, if you read articles, if you read journals, you would exactly see how the first paragraph in the method section is being described. Exactly this way. Okay, so methodology, the next paragraph, you describe the intervention if it's a clinical trial. And then the next paragraph is measurement of outcomes. If it is a cross-sectional study design or case series or case control or cohort, then how did you measure or how did you look at the variables, no? Or how did you measure the variables? So that should be part of the third paragraph. Okay, and then the fourth paragraph should be the sample size and analysis, no? Here's what I again would like not to recommend how not to write it. Some of us would have a preference for statistical formulas that have been never heard by some people. No, that's not the right way to do it. No, when you do your data management and analysis, you just try to use statistical formula that will apply to basic data. In family practice, we're just doing simple research or basic research that doesn't require complex statistical analysis. So it doesn't really necessarily mean that just because you use complicated statistical formula, your research is better. No, that is not true. Okay, so this is how you're going to construct your sample size and analysis. We use Statistica or StatCalc for EpiInfo in computing the sample size. So how did you compute for the sample size? What was the formula in the StatCalc? Okay, then we use our data. We analyze our data by comparing our observations between the two groups, and we presented nominal data as frequencies and percentage. We use chi-square and then t-test and so on. All right. So after doing your methodology, before leaving the methodology, do a checklist. Make sure that your grammar is in past tense. There are papers that are being submitted to us in the journal. And when we read the methodology, some of them are still written in future tense, as if they were copy-pasted from the protocol. No. That's probably the reason why your papers are getting rejected. You're not paying attention to how you're supposed to write the methodology. After the method section, you're now going to write the reference. So in the reference, we have a format. So this is sample format from a journal, sample format from a book. Well, actually, you can get several sample format from PubMed. In PubMed, so here, this is the website in PubMed where you can get the samples of the different citation. You can also cite from a website, and this is the format of website citation. In PubMed, you can also download it exactly like this citation. If you download your article or your abstract in a summary text. When you download the summary text, it will appear exactly like this, on the one on top. Smith, J.D. et al., the title, then the journal. So just download the summary text and then copy it, and then that becomes your citation for that particular article. Okay, so after the reference, the next section that you're going to write will be the abstract. All right, so the abstract is the overview of the study, and basically it should show that your study is scientifically valid and relevant. So how do you do this? Well, you have to make sure that your structured abstract are complete. You should have a 1 or 2 sentence on the background, 1 sentence for the objective, 1 sentence for the subjects, and maybe 1 sentence over setting, 2 to 3 sentences for the design and data collection, and maybe 10 sentences for the results. Avoid saying that results will be discussed. No, you should present some of your key findings in the abstract already. All right, so 10 sentences for the result to present your key findings, and then 1 sentence for the conclusion. So if you have all of this in your abstract, then I'm sure your submission will be accepted for publication. And the last thing that I would write will be the title. The title is usually similar to your research question, PIO, the patient, the intervention, and the outcome. But it is not the research question. And when you write a title, you can somehow choose some phrases like a randomized controlled trial or meta-analysis. So here's an example. This is an example of a title of an intervention, and then outcome is cure or days to resolve symptoms, and the patients are acute respiratory viral infection. So these are example titles: the effectiveness of intervention compared to placebo in the treatment of acute respiratory viral infection family practice, a randomized trial. Or you can also say this: intervention is effective and safe in acute respiratory viral infection, a randomized controlled trial. Or better and faster cure rate. And then you can ask somebody to choose. So you develop 3 alternative titles, and then you ask your mentor, your consultant, or a colleague, which one do they prefer. So it's better if you ask the opinion of a reader which title is better, rather than insist on your own. Because it's actually the reader whom you're trying to catch the attention, not yourself. So make sure that you consult somebody with regards to your final paper. All right, so after the title, what you're going to do last is plagiarism check. You have this available in the website, Plagiarisma. You can just copy paste part of your discussion or part of your introduction, then you paste it here, and it will give you whether there is some sort of exactly similar to what you have written in your paper. Okay, if there is none, then you're good. You're good to go. So you're now going to finalize your paper. And this time, it's now the sequence, no? Title, abstract, introduction, objective methods, and make sure that it follow the sequence, follow the outline as proposed in the consort or strobe or prisma. And then ask a colleague to read or comment on it, and ask if the paper now makes sense. And then once it's okay, you can now submit that paper for publication. All right, so I hope I was able to share with you some suggestions on how to write a final paper. So good luck for your research, and I hope that we'll be getting some of your submission to the Filipino Family Physician Journal. Thank you.